Yes. Let's look at adults now. There are women with ASD that manifest themselves. For example, Grandin. She's well known from one of the chapters of the Anthropologist on Mars by Oliver Sacks. She's famous for the squeeze machine, and she has extraordinary visual and spatial capacities. Another famous woman is Donna Williams. She's a very creative person and a well-known painter. Another example is Gunilla Gerland. She wrote an autobiography, and in this book she described how comfortable she was entering an addiction scene. What she describes is that she didn't fit in a group, and when she joined the people who are smoking drugs, she could be with them, smoke, being relaxed, and didn't have to communicate with others. But she still was part of the group, and that made it very, very attractive for her. And that's what we see also in our clinic. But unfortunately, not all the girls and women are like that. I want to introduce you one of my patients, and I met her 10 years ago. At that time, she was 23 years of age, and she was addicted to cocaine and cannabis, as they misused all the drugs that existed at the moment, except heroin. She already had 6 unsuccessful treatments in different clinics. It was known that she was a victim of sexual and physical abuse by her father, and she was diagnosed as a borderline personality. What did we see after detoxing her? We saw that she has very high levels of anxiety. She was always shy when she was in the group. She found it very hard to speak, and you saw her suffer. She was also very chaotic and clumsy. There wasn't a chair or a table where she didn't bump into, or pour the milk all over the table. She had also severe attention problems, which we later diagnosed as ADHD, the inattentive type. And she was also compulsive. But at that time, we thought that it was because of her traumatic things she had been through. And for example, she washed herself 3 times a day. But later on, when we get to know her better, and when we treated the addiction and the ADHD, we saw more and more problems with the social relations. And what she later explained to us was the biggest problem for her, because she noticed she is different than others, and she is not understanding what other people want from her. But at first sight, you didn't saw that, and it took us 2 years to diagnose her. At that time, we're not specialized in any kind of autism spectrum disorder, because we were an addiction clinic, and from that time on, we were looking more closely to all the patients that came into our department, and we discovered that about 10%, 9 to 10% of the people that come into our clinic have actually an autism spectrum disorder, and we developed a special program for them. What we don't see is the clear-cut autism with low IQs. We see girls with high IQs and mild ASD traits, and the symptoms go unnoticed behind anxiety, learning difficulties, and mood swings. They have good language skills and some social empathy, and it can blur the clinical picture. For example, the patient I was talking about before, she told me a story about her nephew. Her nephew had many behavior problems, and the parents couldn't cope with that very well. For example, at his birthday, there were a lot of balloons hanging there, and when he entered the room, he started to scream and shout. And she said, I noticed that, and I felt so sorry for him because I know how it felt, because he has the same as I have. And I know what it's like to be not understood. Also, the girls and women with ASD tend to be over-anxious and fussy, whereas boys and men with ASD do not seem to feel awkward or guilty. For example, I had also a patient, still have, she is from a very wealthy family. And in that family, they had a lot of parties. And during those parties, she had to be a good host. And she had to talk to everyone. And she hated it. She didn't know what to talk about. And at first, and she went to many treatment programs, they thought she had social phobia. And she had done a lot of social skills training before she entered our department. And when we looked at her, of course, she had also an addiction problem, a severe alcohol problem. We saw that she had an autism spectrum disorder. And I remember that I first told her what she had and what it means. And she was jumping in the room for happiness. She said, I'm so glad that I hear from you that it's not something I do wrong, because all the time I felt so guilty that I couldn't do the same things my sisters were doing. Now I know why I am like I am, and I don't have to do those things. Also, girls and women can show compensatory behavior and also obsessive compulsive behaviors like eating disorders and addiction. What we also see, relationship and sexuality is a big taboo. All the girls, but also and women, and also the men we see in our clinic, have problems on this topic. What's the noise? And after they are more stable, we notice that they have many questions regards to sexuality, and we have to explain a lot of things because most of them haven't got a clue what's normal sexuality like. And they are also easily victims of sexual abuse. All the female patients in our clinic unfortunately were victims of sexual abuse. And most of it is eager to get in contact with others, and then they do things which they don't want to do. Now let's look at a study we've done in our clinic together with another clinic here. It's the university clinic in Nijmegen, and we looked at both groups and we saw they were really comparable, and that made it more easy to combine them. So we had a larger group, and all the data I will show you are of this total group. When you look at the mean age, you see that it's about 36 years. Women a bit lower than men, but almost equal. What you also see here is a bimodal distribution. And what you also see is that, that you have a peak near the age of 20 and another peak at the age of 50. And it's the same in men as it is in women.